How to cure a small bad burn. Although it may be scary and painful to deal with a small burn at home, mini burns are in fact fairly easy to care for. All you require is some understanding of burns, so that you can know how to assess your burn and the treatment it requires, and knowledge of basic. Providing immediate treatment. Cool the affected area with water. The first thing you want to do to treat a small burn is soothe the skin with cool, not cold, water to decrease its temperature. You can do this by running cool water over it from a flowing source, or soaking the burned area in cool water. Allow for at least 5 minutes of soaking to decrease the temperature, so the skin. Be sure to remove any rings or other tight items from the burned area, as the affected region will swell very quickly. If the area is too large to be soaked, then go to the shower and run cool water over it for at least 5 minutes, rather than use flowing water. You could also place a clean towel soaked with cool tap water in the burn. Assess the burn. Once the cooling has taken place, you will feel more comfortable and better able to examine and assess the burned area. You'll need to determine the degree of the burn as well as consider other factors, just as size, location, and type of burn. Assessing these factors will help you determine whether or not you can treat the burn yourself at home, or whether, in most cases, if the wound is a small first-degree burn that is not on your genitals, hands, face, and joints, you can treat and care for the burn at home. Pat the area dry. Use a soft cloth and take care not to use anything abrasive. Be gentle and pat, don't rub, especially if there is any blistering or outer skin damage, as you don't want to pull off any of the skin. Apply some ointment. Once the affected area is dry, obtain an ointment, and apply a generous amount, so that you're covering the burn, but not rubbing it in. The ointment can have antibiotics in it, but does not need to. Other options include petroleum jelly or aloe vera gel. If using aloe vera, make sure to use only 100% pure aloe vera gel, and not a Neosporin is a good over-the-counter choice for an antibiotic ointment. If you are allergic to Neosporin, you can go to the doctor and obtain a prescription for Bacitracin or Bactroban. Apply a protective dressing. A protective dressing is made from rolled gauze that you can purchase at any drugstore or pharmacy. After applying the antibiotic ointment, wrap the area in a circular fashion with the rolled gauze. Secure the dressing with surgical adhesive tape, also available. This protective dressing will do two functions. First, it will provide a protective barrier against re-injury. Second, the covering will also provide protection from infection, given that your skin's natural barrier from infection has been compromised due to